How do I access my health record? Welcome back. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Kindly first answer 3 quick questions. The standards for privacy of individually identifiable health information, also known as the Privacy Rule, became a final rule of HIPAA in 2002. You remember HIPAA? It is the Health Insurance Portability and Accountability Act of 1996. When HIPAA was enacted, most of the focus was on how to protect and transmit your health information. This was important because plans were being made to take our healthcare information digital. Lawmakers knew there would be a day when nearly everyone would have internet access, which meant you could someday readily access your health records, even with a cell phone. So in 2002, the Privacy Rule clarified HIPAA's stance on our healthcare rights, stating that we all have the right to request to access our health record. If you enter this, 45 CFR 164.524, into an online search engine, you will see the written regulations. CFR stands for the Code of Federal Regulations. 45 stands for Public Welfare. The double S section symbol guides you to Part 164 and Section 524. Sometimes parentheses can follow to signify specific paragraphs. Section 524 describes your right to access your health record. You can think of access to mean view, review, or read. In order to request to access, you may need to visit your medical office or institution and sign an authorization for release of protected health information. You do not need to send these records to another doctor. You can have them sent to you. It is your federal right. Medical providers have 30 days to allow you to access your health record. The provider must allow you to access your health record, or he or she must give you an explanation in writing as to why you are not allowed to see your records. Some health records are exempt from HIPAA. Psychiatric notes, most workman compensation, and motor vehicle records are HIPAA exempt. If the notes are HIPAA exempt, then the provider does not need to send you the denial letter. The provider is permitted to deny the records if he or she feels that the information could harm you. In addition, if the provider has a problem, then he or she may document additional needed time. This gives the provider an additional 30 days, and the provider must let you know this. You may be charged a customary fee for photocopying the pages for you, should they be printed, and postage, should they be mailed to you. The Department of Health and Human Services and the Office for Civil Rights, OCR, oversee compliance with the Privacy Rule. The OCR is responsible for enforcement, which includes complaint investigations and compliance reviews. That office is also empowered to assign civil money penalties and criminal prosecution. A government online complaint portal and a toll-free telephone support both exist to receive complaints and initiate investigations. One of the purposes of this series is to empower you so that you do not need to reach out to the government for help. The authorization for release of protected health information will ask you to specify what part of the record you would like to access. Do you want everything, or do you only need the last office visit? I suggest you start with the last office visit. If your provider has an electronic health record, EHR, then you may have an option to log on to a secure patient portal. This will let you see your health record. Most portals, however, are set at Government Meaningful Use 2 standards. This means that you can only see part of your record. If you see a provider in the office, for example, the current portal displays will not allow you to see what you told the doctor. Your story is hidden. Portals will soon expand to show everything. Meanwhile, in order to see everything, you may need to request to see your health records. If you run into a problem when you request to access your health record, you should confirm that the provider received your request. If you're not successful, I urge you to contact the office manager or the hospital or health system compliance officer. I encourage you to read your health records. In this series, I will also teach you how to understand what you read. In some cases, good enough that you could write it yourself. To get it in your hands and in front of your eyes, you may need to request to access. Reading your health records is your first step toward being your own patient advocate. Thank you for participating. Kindly answer these 3 questions, and I'll see you at the next module.